Now in the fifth section, we will talk about some miscellaneous condition that affects the external auditory canal. In this, we will talk about the impacted wax or cerumen, foreign bodies of the ear, and acquired atresia and stenosis of the meatus. Impacted wax or cerumen. Here, impacted wax cerumen is a very, very common condition. Usually patients see the doctor with because they feel they have heaviness in the ear, or they feel there is blockage of the ear, and there is hearing loss also on the affected side. So impacted wax or cerumen, this is the histological picture. This is the cartilage. Then there are sweat glands present, sebaceous gland, and then the hair follicles. Sebaceous glands are the glands that produce the cerumen or the wax. So this is the ear lavage technique to remove the impacted wax. Usually bulb syringe is used to remove the wax. Patient is asked to hold the kidney tray under the affected ear, and the head is tilted slightly up this way, so the ear is any fluid that is coming out of the ear should go into the kidney tray. So patient holds the tray under the ear, and then for the adults, the technique to hold the ear is up and out, and for the children is down and back. So for adults, up, and for the children, downwards. So the ear canal should be straight. The syringe used to do this procedure is the bulb syringe. It's a big metal syringe that holds about 50 cc of fluid, and then the nozzle of the syringe should be pointed upwards towards the roof of the ear. The purpose of this positioning is to avoid the injury to the tympanic membrane. If the flow is direct, it can damage the tympanic membrane. So that's how you remove the fluid, the impacted wax, and then after the wax is removed into the kidney tray, the patient, you clean the ear and all the area, and patient should lie down on that side for few minutes, so there should be all the fluid that is present inside the ear should be drained. So this is the picture. Once the fluid goes around the wax or any foreign object, it comes out, and that's how the fluid goes and the impacted wax comes out. Foreign bodies of the ear. This is the foreign body. You can see different foreign bodies can be non-living or living objects, or living like insects or flies can go into the ear too. So foreign bodies can be living or non-living. Non-living foreign bodies include a piece of paper or sponge, grain seed, slate pencil, piece of chalk, or metallic ball bearings. All these things, especially when the children, they are playing with different things, they put the object in the ear, and in the process of removing the object can go further and it gets impacted. So foreign bodies in the ear are not uncommon, and especially when it's seeds or any grain or any grain seeds, or any like peas, small peas can also go into the ear and they can get impacted. They can swell up and cause very bad pain in the ear. Methods for removing can be forceps, use of forceps to remove the foreign objects, syringing, suction, and microscopic removal with special instruments. Syringing like ear lavage I mentioned in the previous slide can also be used to remove the non-living object. And then postural approach. Foreign bodies of the ear living, especially if they are living like flying or crawling insect like mosquitoes, beetles, cockroach or an ant, all these can go into the ear. Maggots in the ear. Treatment for these, make sure the treatment for the non-living and living foreign bodies is little different. Living foreign body should be first killed and then it is removed, because if it is not killed then it can move further away and can cause the damage. So instilling chloroform water to kill the maggots, which can later be removed by the forceps. Then acquired atresia and stenosis of meatus. If there is stenosis is narrowing, or if it's atresia, no opening at all of the meatus acquired. How it can happen? Different infections, for example, chronic otitis externa, an important cause of atresia. And then trauma like lacerations, fracture of tympanic plate, surgery on ear canal or mastoid. All these can lead to atresia or stenosis or narrowing of the auditory meatus. Burns, thermal or chemical. Different burns can also cause atresia due to adhesion formation or scarring. Treatment is meatoplasty. Plasty is repair, so opening of the meatus, making the canal bigger. So that's the treatment, surgical treatment of the atresia and stenosis. So that was all about our lecture, disorders of external auditory canal, in which we talked about the different factors like congenital disorders, how we can treat different traumas, how we can treat different inflammations, infections, which can be reactive, or then we also talked about different tumors of the external auditory canal, how we can remove the impacted cerumen and foreign bodies and objects from the ear. So hopefully you learn a lot from this lecture about the disorders of the external auditory canal. So thank you for watching sqadia.com.